Hi, this is Dr. Gandusky. I'm going to talk today about hip pain, what can cause hip pain, and why could your hip be bugging you. So we'll talk about what the possibilities are and some anatomy of the hip, and hopefully gain an understanding about what could bug you around the hip. I think you'll be surprised to know it's actually very common for patients to think they have a hip problem that's actually not coming from the hip joint at all. So we'll talk about that as well, and what could cause pain around the hip. So first, let's start with a little bit of anatomy. It's really important to kind of understand a little bit about what the hip joint is and where it is to really understand how it can bug you. And so this is a picture of the pelvis and the hip joints. So the pelvis is they are connected to your lumbar spine, which comes down from obviously your low back. And then the hip joints are ball and socket joints. You have one on each side, and they are really deep in your groin, deep inside your body. That ball and socket joint is shown here in this model is lined with cartilage. That's represented by the blue in this model. So there's some blue cartilage on the end of the ball of the femur, and there's some cartilage inside the socket. And so just like all joints that are healthy, nice thick cartilage that you're born with is there in a normal state, and that's the way it should be in a normal hip joint. This is a model that shows the right-sided hip with overlying muscles. The red line actually indicates the muscles we spread apart for an anterior approach hip replacement. And then the left hip is a clear boned model, which shows a hip joint replaced. And so you can see within that muscular envelope of the thigh, deep in there is the hip joint itself. And the hip joint, that ball and socket joint, can be replaced with a hip replacement. Other important anatomy to know is muscles and things, soft tissues attached to the hip joint. A really common source of pain that we'll talk about is inflammation of the hip bursa. So that blue there, the line that's drawn to the trochanteric bursa, that's some tissue that can get inflamed very commonly. It lives outside of the hip joint, and it's on the side of the femur next to what's called the trochanter of the femur, which is that bony prominence. And it really tries to prevent the bone of the femur from irritating the iliotibial band that goes all the way down the side of the knee, but it itself can get inflamed sometimes and cause hip bursitis or trochanteric bursitis, which will commonly cause pain on the side of the hip, and that's where that is. The hip and the back are linked. For example, when you sit, the hip joint and the spine move if they can. If a spine is stiff, you need more motion to have this happen at the hip joint to allow you to sit. So in this model, you can see this patient who is going from standing to sitting has some motion that occurs at the back as well as the hip joint in order to allow them to sit. But if this spine is stiff or is fused, then more motion needs to come from the hip joint. So this is really just to show you that there's a lot of interplay between the hip and the back. And this is something that we take into account within your diagnosis and your treatment. The labrum is a soft tissue ring that is around the socket of the hip. It's really similar to the meniscus of the knee, and it really tends to get beat up as we age with arthritis. So really, eventually, everybody will get some tearing of the labral tissue with activity. That can be mild fraying, and generally, most commonly, is not symptomatic. We'll talk a little bit more about that later. But that's what the labrum is. The labrum is that ring there shown that surrounds the socket of the hip joint. And it's a soft tissue structure, so it's not bony and it's not cartilage. Here's some x-rays of some conditions that we'll see in the clinic quite a bit with patients. And we'll go over kind of what this looks like. Here's a healthy hip joint and a hip joint with severe arthritis. So remember, the hip joint's a ball and socket joint. And so between the ball and the socket should be space, and that's where the cartilage is. Cartilage you cannot see on an x-ray. And so at the top of that ball, you'll see the space between the ball and the socket. That space there is normal cartilage in a healthy hip joint. In that model there on the bottom, that colored picture shows the blue healthy cartilage and then an arthritic joint on the other side, on the right side, where the cartilage is gone. And then in the x-ray of the hip, that blue arrow with the severe arthritis shows none of that space between the ball and the socket. So that's complete bone-on-bone arthritis and severe arthritis of that hip joint. There's some things that you'll hear about as well, and some things that are fairly common that we see in the office that patients have that can cause things like early arthritis or hip joint problems more commonly. Some of these have to do with the condition of the hip, the way the patient was when they were born. For instance, hip dysplasia is a fairly common condition that is basically a shallow hip joint. So you can see in this patient that coverage of the ball by the socket over the top, which is signified by that blue angle there, is pretty small. And this is a patient that doesn't have a lot of coverage of the socket over top of the ball, and some other changes like a really steep neck angle of the femur. That happens really commonly in a patient with dysplasia. This is basically a shallow hip socket, and shallow hip sockets tend to more commonly go on to be arthritic because of the way the anatomy is of the hip joint. And this is a congenital condition, so people are born with this type of hip condition. And it happens more commonly in certain people, but we see this fairly commonly as a reason for younger patients to need hip replacement. Another condition that can occur is what's called avascular necrosis, which is some dead bone in the hip joint. This is seen on an x-ray sometimes, but is better seen on an MRI. This is an MRI image that shows these areas of black stripy activity in the femoral head. That should not be there. The femoral head should just be homogeneously gray, and these are really characteristic lesions of what's called avascular necrosis. This happens from bone that is unhealthy and dies in the top of the hip joint. This can happen for multiple different reasons. This is something we think about in somebody with some bad hip pain that doesn't have too bad of x-rays, because it's a condition that occurs inside the bone as opposed to at the interface between the joint. One of the more common things that can cause this in the American population is heavy alcohol use chronically, as well as oral steroids. And this is hip with arthritis with a narrow joint space and loss of that cartilage space in the ball and socket joint, and then a hip with a hip replacement. So basically in a hip replacement, we are taking the bone-on-bone arthritis and getting rid of it by creating some man-made parts that will now articulate like a ball and socket, just like the normal hip joint. But that takes away the pain because you can no longer feel that because there's no nerve endings in that man-made material. So that's what's called a total hip replacement. The key to helping a patient get better is really getting the right diagnosis. So if we don't have the right diagnosis in somebody, we really can't help. And so that's step one, is trying to figure out exactly what's causing the pain. And you'd probably be surprised to know it is really common to see somebody who thinks they're coming in for hip pain who actually does not have a hip problem at all. And so this will hopefully help you, show you what are some things around the hip that can bug people, that can cause discomfort, that actually are not the hip joint. And so let's look at this picture to learn a little bit more about the possibilities for hip pain. So this is a patient that's standing from the front and the side, and I don't want you to get too confused with all the big words, but if you just focus on the two arrows and the red circle, I'll kind of go through some common areas that people have discomfort and talk about what the most common things that those locations are. So if you look at the patient standing from the front with the red arrow pointing to the groin area, that is a common location of pain that comes from the hip joint. And the arrow on the right points more to the side of the thigh. So that's on this kind of the side of the top of the thigh. And then the circle on the back is over the low back and buttock. So those are really common locations for patients to point to when they have pain around the hip joint and come in and say that their hip is hurting. And so one of the most important things we do is to say, okay, well, point to where it bugs you. And so out of those three locations, those are the places where we can help kind of differentiate what's going on and what the source is. So let's talk about the arrow that points to the groin. Most patients with true hip joint problems, including arthritis, localize pain in the groin. There's other things like hip flexors and other soft tissue inflammation that can also cause pain there. And also there's a broad possibilities that we think about. Things like inguinal hernias, which are very common, can cause pain in the groin. And so we're thinking about all those things, but true hip joint pathology, meaning like hip labral tears, hip arthritis, generally cause pain deep within the patient's groin. The other arrow right, which is showing pain on the side of the thigh, is also incredibly common, and it is most commonly caused by inflammation of the hip bursa or bursitis. It can also be caused by some irritation or tears of the abductor muscles, which are muscles on the side of the hip as well. But these things are outside the hip joint. They are not inside the actual joint of the hip. They're outside of it, and we learned a little bit about the anatomy of the trochanteric bursa, which can get inflamed, and that's a very, very common location to have discomfort around the hip joint that's not actually coming from the hip joint itself. Lastly, the circle is a common source of pain. So hip arthritis, sometimes you can get it in the buttocks. People complain of pain in the buttocks, but again, much more commonly, that occurs in the groin. But pain in that area that is basically around the buttock and low back and sacroiliac joint much more commonly comes from the lumbar spine or the sacroiliac joint itself. And so that tends to be a little more of a back problem, more commonly worked on and treated by back specialists like spine specialists, orthopedic spine surgeons, neurosurgeons, and non-operative spine providers. So these locations are really, really important to help differentiate exactly what's bugging somebody around the hip. So when is it likely the hip joint? So these are some things that really generally point to the hip joint as the actual source of problem. Again, pain in the groin with radiation into the thigh is the most common thing, the front of the thigh. But really want to think about other things that can cause groin pain like we talked about. You can have hernias, you can have lymph nodes that are enlarged in the groin, you can have hip flexor irritation, and sometimes actually even testicular issues can be referred to the groin. Patients often will make what's called a C sign, so they'll kind of grab their hip in a C with their thumb and index finger and say it kind of hurts all around here between the groin and wrapping around the back of the buttocks. That's called a C sign. And sometimes patients can have just buttock pain, but generally I only really think about this as a source of a hip if it corroborates with their x-ray. So if they have severe arthritis on their x-ray of the hip and they say it hurts in the buttocks, and when I rotate their hip, that's really where they refer the pain to, then that can happen, that the buttocks is the primary source. Also, very commonly, when you flex the hip, so if you flex the hip up and rotate it internally, that will often always bug people with hip joint problems as well. And if that pain is reproducible, then we can start thinking about the hip joint as an etiology. Otherwise, for patients that have buttock pain, we always want to think about lumbar spine problems, especially nerve root irritation to the low lumbar spine, like L5 and S1 can irritate the buttock pain, or sorry, be a cause of buttock pain. So for instance, if you have a herniated disc or arthritis that's pinching on those low lumbar nerve roots, buttock pain can be really the only manifestation. And there's a lot of other soft tissues in the back of the hip, like the piriformis and hamstrings, tendons, that can cause pain in those areas as well. And those are on the differential of that location of discomfort. Once in a while, hip joint arthritis can present with just medial knee pain, which is always really interesting. There's a nerve that runs down the inside aspect of the thigh, down to the inside aspect of the knee, and sometimes patients with hip arthritis actually will complain of pain on the inside aspect of the knee. When you rotate their hip, sometimes that'll reproduce the knee pain, and especially in a stiff hip, you start wondering about the hip as the etiology of the actual knee pain, and then sometimes we get a hip x-ray, and that's actually the source of the pain. So that's something that we always think about and have in the back of our minds. Leg length is a common topic in the lower body. You can feel like you have a difference in leg lengths for a lot of different reasons. It's usually pretty easy to figure out with a good history exam and x-rays, but first we need to talk about your history, and then we measure the lengths in the office of your legs. The spine plays a really important role in leg length discrepancy, especially in older people, because it's very common to have what's called regenerative scoliosis, which curves the spine and causes the pelvis to be tilted instead of flat. And this can cause what's called an apparent leg length discrepancy, meaning the legs actually themselves aren't different in lengths, but you can feel like they're different because the pelvis is tilted up or down on one side, and it can make you seem like you're quite significantly different in the length of your legs. We can usually get to the bottom of this overall in clinic, and it is something that we can change a little bit with hip replacement. We can change leg length a little bit with hip replacement. So first we kind of talk about what you think is going on with your leg lengths. If you think one side is short or one side is long, and then we look at your back, and then we measure it on imaging and really make sure this makes sense to us. This is an example of what can happen in a patient that has degenerative scoliosis. So this is a patient from the front, and you can see how their spine is really curved, kind of in an S shape. That spine curvature causes what's called pelvic obliquity. The pelvis, instead of being flat, so completely flat, a flat line, is now tilted, and you can kind of see that. So on this patient, their right side is actually elevated the way they're standing, and the left side's a little bit down, tilted down, and that's called pelvic obliquity again. Can do is kind of push the leg down on that affected side where the pelvis is down. And then when you look at the feet, the right side, the left side, which is tilted down, will seem longer than the left side. But again, it's not coming because of a true length difference in the actual legs. It's coming because of that oblique pelvis that occurs because of degenerative scoliosis. And as you can imagine, that is not something that can be treated, outside of major corrective surgery from a neurosurgeon or orthopedic spine surgeon. So that is something that kind of will persist over time, and again is very, very common in people. This is another example of what can happen with a tilted pelvis. Sometimes some weakness in some of the muscles of the hip can cause that pelvis to tilt. And again, you can see, this patient's going to feel like they're long on one side where the pelvis is tilted down. So now let's talk about a few conditions that can affect the hip joint and cause pain. First will be the labrum. So the labrum is a soft tissue ring around the socket of the hip. We talked about that. It exists around the periphery of the joint. If you have a labral tear, you can get groin pain, popping, and catching. And it's really important to sort of differentiate patients with this type of pathology, because sometimes younger patients have labral pathology that's significant, and they can get these type of symptoms in the absence of arthritis. When you get older, the labrum necessarily gets beat up, and so it will get torn. But when you have especially arthritis, the source of the pain is the hip arthritis and not the labrum, and the labrum is kind of like an innocent bystander. So it's very much like the meniscus of the knee. When the knee is very, very arthritic, the meniscus becomes sort of superfluous because it's generally not the pain generator. Similarly, in a labrum of a hip, in an arthritic hip, the arthritis itself is what's generating discomfort, and the labrum is an innocent bystander. The labrum also goes away with the hip replacement, so that kind of gets taken out, so you know. And all patients with arthritis have a labral abnormality. But again, it's usually not the source of pain when you have severe hip arthritis. And so one thing that happens pretty commonly is patients will get an MRI of the hip, and the MRI report will say that there's a labral pathology or a labral tear, and they're concerned about it. But first of all, MRIs really overdiagnose small labral tears, and they're not really very significant. And they kind of confuse everyone, including providers and patients, because they're part of an MRI report, but really somebody will have either a pretty normal labrum that's a bit of an overcall on the report, or severe arthritis or other pathology that's causing the symptoms, and the labrum is really just a superfluous aspect of the overall discomfort. And so that's just important to know, because that is very common. Most labral tears do not need surgery, and rarely when they do, they're treated by hip scope specialists usually. So orthopedic sports surgeons who do hip arthroscopy, which is small incisions and look inside the joint with a hip scope, can sometimes take care of significant labral tears if it is necessary. Again, these are pretty rare, and I do not do hip scopes. I send these to my orthopedic hip sports colleagues to deal with if I think that needs to happen. Hip bursitis is really, really common. That green arrow points to the hip bursa, which we talked about, again, which is outside the hip joint on the upper outer thigh. So the few important points, because this condition is just so common. The bursa is meant to protect the soft tissues on the side of the hip from irritation from the prominent trochanter of the femoral bone. That trochanter is that jutty protuberance of the femur that's underneath the bursa. But the bursa itself can get inflamed and get painful. It's very common, and it can happen often with or without injury. Sometimes you'll bump the side of the hip and that'll set it off, but more commonly than not, it just happens from day-to-day activity in many people and is really one of the most common things to affect anybody over 40, I would say. The symptoms are pain on the side of the upper thigh, sometimes radiating down the outside of the thigh and up into the buttock. Tenderness over the area to touch, because it is pretty superficial. So most times if you really push, you can really irritate that area, as opposed to hip arthritis. Hip arthritis is very deep in the joint, and generally you can't really push in anything to hurt hip arthritis. But in the hip bursa, because it is superficial and outside the joint, if you push on that area, that will be tender and help diagnose the issue. Oftentimes patients complain of pain laying on that side at night and pain getting up and down from a chair, and pain when you rotate the hip, especially rotating the hip out. But one of the most common things is inflammation of the bursa that causes pain when you lay on your side at night. Because as you look at that skeleton picture there, the things that hit your bed at night when you sleep are the top of your pelvic bone and that trochanterior area. So if you have inflammation there, that's going to be uncomfortable. The treatment of this condition is most commonly things like anti-inflammatory medicines, activity modifications, meaning if you're doing an overuse an overuse activity with chronic repetitive motion that causes inflammation, then slowing down on that or varying your activities can help. And then also steroid injections into the area can help. And that's really the treatment options for this. Generally, non-surgical specialists and primary care physicians will commonly perform these injections. The injections are very simple and pretty straightforward, and most times can be dealt with by non-surgical specialists or your primary care doctor. Let's talk about hip osteoarthritis. Hip arthritis is very common, just like knee arthritis. We walk on our legs, and really anybody with who's reasonably active could eventually get hip or knee arthritis, and this is the reason why these things are so common. The pain can often be acute onset without injury, and this often surprises people that they've started having pain really without an injury. But this is kind of what happens very commonly with arthritis. The background cartilage wear and tear is happening slowly over decades, and most people don't really get too many symptoms until they reach a critical level of cartilage loss that is so bad that now they have bone-on-bone arthritis and the inflammation gets severe. And so this can happen just with day-to-day activity. As soon as that little bit of cartilage goes away that was really helping keep symptoms away, now that bone-on-bone and that really bad irritation is going to happen, and it can feel like it came on all of a sudden, which is really, really common, but really it's sort of been happening in the background for a long time. It's also very common to get pain at night with hip arthritis, or really any arthritis in general. There's something about our brains being active during the day and getting around and walking and moving and doing things and being distracted by life that allows the inflammation to happen during the day when we're up and down on a knee or a hip. But at nighttime, we really have time for our brains to settle and really realize how much discomfort's coming from a joint. And so it's very, very common to have arthritic pain at night. It's very common for people to think that they have a muscle or groin pull when they have hip arthritis, because it can feel like a deep groin ache, and they think that they probably pulled a groin muscle or something like that. But when we get an x-ray and it shows severe arthritis, then that's almost always the answer when that looks like that. The treatment of hip arthritis is pretty straightforward, because there's not a lot of options for hip arthritis. Because we have to walk on a hip, they generally things like anti-inflammatories, canes and walkers, plus or minus injections and replacement are the options. So there's another talk about treatment options for hip and knee arthritis that you can look at for full treatment options of this. But generally, there's not a lot of useful options for hip arthritis, because it's a very big joint. It undergoes a ton of stress, and really a lot of inflammation happens in a severely arthritic hip joint that very commonly cannot be treated with simple non-surgical things. So remember, the hip is connected to the pelvis. So the cup is in the pelvis, or socket is in the pelvis, and the ball is on the end of the femur. That's the hip joints. That's connected to the pelvis through the socket, and then the lumbar spine is also attached. So there's a lot of interplay between the back and the hip joint with motion. The ball and socket joint is covered with cartilage, that blue stuff. The blue stuff is here, that healthy, thick stuff you're born with, and ensures the bones move smoothly over each other. So I like to kind of liken it to the Teflon coating on a pan. So basically, the two smooth, slick surfaces you're born with work to keep friction away and keep inflammation down. And when that's gone, that's what arthritis is. Here's some pictures of a healthy joint. So when cartilage wears away, the bone gets exposed, and that rubbing is like two marbles rubbing together. It causes pain, inflammation, and swelling. And so I usually liken this to two marbles that are kind of lubricated with oil, and they kind of glide over each other when they're lubricated. And then when they lose that, if you just take two dry marbles, they would rub against each other and scratch and cause inflammation and wear. And that's what causes the swelling and inflammation in a joint. Osteoarthritis is wear and tear arthritis. Inflammatory arthritis, like rheumatoid arthritis, is caused by abnormal inflammation in the joint that destroys the cartilage. The end result is similar, which is cartilage loss in the joint, which causes pain. And again, cartilage cannot grow back. You're born with it, and when it's gone, it's gone. So whether it comes from wear and tear type arthritis or an inflammatory condition like rheumatoid arthritis, when that cartilage is gone, it's gone. It can't come back and causes inflammation. Here's a model that just shows some irritation of the cartilage and fragmentation of the cartilage. This signifies arthritis, but this is essentially what happens is that nice blue homogeneous coating of cartilage goes away and you're left with some fragmented, patchy coverage and loss of cartilage, and that's what causes the pain. This is a hip with arthritis, so no more cartilage space between the ball and socket joint on the top of the ball and socket joint. And then what it looks like when we replace the socket and the top of the femur, and this is a total hip replacement. You can learn more about what causes hip pain and other topics at different websites. Here's my website, has multiple different talks about hip and knee um, conditions and treatment options. Also, places that are trustworthy, like the American Association of Hip and Knee Surgeons, as well as the American Association of Orthopedic Surgeons websites, have some really good trusted information. Just remember to look at trusted websites and things that are vetted by science and good organizations that put out good data, because there's a lot of sources on the internet that are not incredibly useful. Just make sure that you're not looking at anecdotal stories and things without real evidence. Well, thank you. Hopefully you learned a little bit about what can cause hip pain, and thanks for listening.